Well, hello, all you beautiful people, and Happy New Year. I hope you're just as excited about starting 2021 as I am, especially after the kind of year 2020 has been. Welcome to the first installment of Do It Right with Dr. Ansu. That's me. My name is Ansu, and I'm an osteopathic physician, aka DO, and I practice family medicine. So let me just stop you right there. You're probably wondering, what is an osteopathic physician? A DO? What does that even mean? And the million-dollar question, and I wouldn't be surprised if you're thinking that, are you even a real doctor? Let me assure you that yes I am. And according to my patients, a pretty good one too. But if you just thought these questions, you are not alone. In fact, I have been asked this question since I started medical school, and I still get this question almost 10 years into practicing medicine. So first of all, DOs don't practice in every country. So if you happen to be from a country where there are no DOs, well, it makes sense why you never came across one, because there just aren't any where you are. In fact, currently DOs have full privilege to practice medicine in about 50 countries and partial privileges in some various other countries. However, if you're in the United States, you probably have come across a DO a lot more often than you think. In fact, 25% of the medical student population currently consists of osteopathic medical students. So if you're in the US, chances are your doctor could be an osteopathic physician and you just never knew it. That is because osteopathic physicians are full-fledged doctors. We are licensed to practice medicine, prescribe medications, and do surgery if you're a surgeon, just like medical doctors. It's something that set apart DOs from MDs, and that is the Osteopathic Manipulative Treatment Training, or OMT. DO students go through about 200 hours of additional training of using their hands as a form of a diagnostic tool. Think of it as a stethoscope. You use a stethoscope to listen to the heartbeats, to listen to the lungs, to listen to the airflow, and it helps you learn a little bit more about what's going on with the patient. Similarly, we have been trained to use our hands to feel our patient's body and see where there are restrictions, where there are tension areas, things that we can feel and hopefully address depending on the situation. It is an amazing tool that I have used personally with my patients, and my patients appreciate that because it gives them something more than just putting them on medications. And in fact, a lot of people actually don't want to be on medicine. Sometimes I want to put them on medicines and they don't want it, So it is amazing to have something else to offer than medication in some of those instances. But not all DOs may practice osteopathic manipulation after graduation, which is fine. They just stick to their medical training. And partially it is because of today's climate. We live in a world where everything needs to be done fast. Insurance companies don't want to pay for a lot of things. And it takes time. It takes time to touch somebody and feel their body and do treatments, And if someone has a very busy schedule, it's understandable that they may not want to. That does not make them any less of a physician or any less of an osteopathic physician, because osteopathic physicians have been trained both in osteopathic manipulative medicine as well as medical training in general. So you may have an osteopathic physician who's your doctor who's never practiced manipulation and yet is practicing good medicine and providing you good care, because at the end of the day, we're all trained to be good medical doctors. But if you were to look up DO versus MD on a search engine, chances are you may come across certain labels like DOs are more holistic and MDs are more scientific in their care. I'm not really sure what that means because, first of all, a lot has changed in both osteopathic medicine as well as allopathic medicine over these years, since when it first started. And unfortunately, it's not a very accurate description. I have come across plenty of allopathic doctors who are very holistic in their care, thinking of the whole mind-body aspect. And I don't know a single osteopathic physician, personally at least, who does not practice evidence-based medicine that is relevant to their times. But it is these labels that cause confusion for patients, and not just patients, but even media, which we recently saw when President Trump was hospitalized with COVID-19, and media made an announcement wondering why his care was being taken care of by an osteopath and not an infectious disease specialist or an internist. This was in reference to Sean Conley, who was the White House physician, who was a Navy SEAL veteran, who's an osteopathic physician trained in emergency medicine. This mischaracterization of a DO as just an osteopath and not a real doctor led to a severe backlash from the American Osteopathic Association and several DOs to #GetItRight. This was aimed at correcting all the information that is out there that has been portrayed by media. And this is where I come in. I myself had posted on social media about who I am as a DO, what I've gone through as far as osteopathic medical training, and what I provide for my patients. And several people commented thanking me that, you know, I was educating them. And I was surprised because I expected some of these people to know what a DO does. And that got me thinking that if the circle that I'm around doesn't know what a DO is, there's probably a huge population out there that really doesn't know what an osteopathic physician is. I searched YouTube to see what came about on osteopathic physicians, and I came across a few MD versus DO videos, and some videos on osteopathic manipulative medicine geared towards medical students. But there was really not much information for the general public, real medical information that a non-medical person could understand. As an osteopathic physician who's also a family practitioner, I have a huge age range that I take care of, from the newborns to folks in their 90s and going into their 100s. And because of this range, I practically see almost everything that you may think of. But I don't always reach for medications first. Sometimes I do, because sometimes medicines are the only things that will work. But there are times where I start off with osteopathic manipulative treatment with supportive care and having the patient work on things on their own. And we follow up to see how things are getting better or not, whether we need to try a different approach. One of the reasons my patients like coming back to me is because I listen to them. I remind them and I allow them to be active participants in their health. And I teach them about their illness and how to treat their illness without using a whole lot of doctor words. I use both my osteopathic medical training along with my medical knowledge to give my patients the best care possible. When students apply to medical schools, one of the most common answers that we're told not to respond with is to the question, why do you want to become a doctor? And almost everybody wants to say, because they want to help people, which is true. No one goes into, or I should say very few people go into medicine without the desire to help people. We want to make people better. We doctors have taken an oath to help people. This is my passion. My goal through my videos is to help you learn more about your body, how to take care of it, and share my skills and knowledge so you can help take care of yourself better. So if you're interested in learning more about how to take care of your health the osteopathic way, please hit the thumbs up button and like the video. My husband told me to do that. And subscribe to my channel. I will post my next video on Monday, which is in 3 days. And I hope to have a video almost every Monday, but I am working and I have 3 children, so no promises, but I will try my best to stick to that schedule. If you have any questions or comments, please share that. I am so excited to start this journey using social media as a way to improve health, and I really hope you join me in this journey. Until then, please take care, stay safe, wear a mask, and join me next time to Do It Right with Dr. Ansu. Bye.